tardive means this particular side effect happens several weeks to several months later after taking certain psychiatric medications called the antipsychotic medications. And that is what TD means, tardive dyskinesia. Dyskinesia means abnormal movements. So kinetic is movement or moving is kinesis or kinetic. Kinesia is a condition about movements, and dyskinesia, dyskinesia, dyskinesia means abnormal movement. So abnormal movements that come on later or so after taking antipsychotic medications for a while is tardive dyskinesia. I may or may not be the greatest mimic. So I will demonstrate a few things. And there are various versions of that. Of course, you can only see the upper half of my body in this. So I will try to raise my hands and show the limb part of it. So most of TD occurs in the orofacial region. In the oral region here around the lips and the tongue and the facial. So it's orofacial. Orofacial TD may look something like that is orofacial TD, where muscles around the lips, muscles of the tongue, and muscles of the lower part of the face, they are having these abnormal movements like that sort of thing. That is classical orofacial TD. Now, you can have it in hands and legs, and then it would look like that. The same thing can happen in the toes. So TD most often is in the facial region, followed by the hands, and then less common in the toes. But it can affect virtually any muscle of the body. So you can have a neck TD. It's a bit more severe version. You can have a truncal TD. The trunk can go. So you can have neck TD, you can have trunk TD, and then you get into more exotic forms of TD that many people don't know about. You can have TD of the vocal cords, the muscles of the voice box, and then the voice of that person may flutter. Their words may not come out right. Words may appear like garbled up. That is because the person may be having vocal TD, vocal as in VOCAL, vocal, or that of the voice box. You can have stomach TD. The muscles of the stomach can also become dyskinetic, and such a person could have some stomach discomfort, may have some episodes of vomiting, throwing up, emesis. And many times these things are missed when a person, especially one with a mental health disorder, a serious mental health illness like schizophrenia, complains of these things. There is unfortunately a tendency to write it off, saying, oh, he doesn't know what he's talking about, and is talking very odd or in a weird sort of way. But in fact, what is happening is that they may have TD of the voice box, they could have TD of the stomach, so they're much rarer. Okay, so these are all the various types of TD.
I think the worst one was when I was eating, I would spit, food would not stay in my mouth. I had issues walking, my gait was unstable, and I actually caused myself a pretty severe knee injury from taking an odd step. I also had uncontrollable facial movements. And I honestly didn't even notice that part until later. But friends told me, like, once I said, oh, guys, I have a movement disorder from my medication, people were like, oh, we just thought you had facial tics. And I was like, no, I don't have facial tics. So nobody mentioned it because they're kind. They don't point out things like that.
The maximum risk of TD emerging in a person is between 3 and 12 months. Now, after that, the risk is low, but it does not completely go away. Some people may develop TD 2 years after they're taking medication, and some people even much later, 3 years, 4 years, 5 years. If someone does not develop tardive dyskinesia or TD after taking a medication for about 5 years, as a physician, I would be less worried after that. Usually, if it didn't happen in the first 5 years, it is not likely to happen. Again, with exception, there are always exceptions to these things, and there will always be somebody who had it for the first time after 10 years of taking it. But on average, if you look at 100 patients, 100 people taking these medications, and we're going to say that 5 people will get it with first generation per year, and so in 5 years, 25 people would get it. Of these 25 people, most would have gotten it within the first 5 years. And within that group, most would have gotten it within the first 2 years. But if we start looking at the elderly population, for example, people who are 55, 60, 65, 70, 75, then the rates go up more than what I said. Women, especially after age 50, when the estrogen levels come down, estrogen is protective, and estrogen levels come down, they are at a much higher risk. Female gender itself is a higher risk, but after estrogen goes down, it is even higher. Elderly populations or elderly people are also at a much higher risk. People who have had any kind of traumatic brain injury, multiple concussions, if they played football or whatever when they were younger, or had a motor vehicle accident, then they are at a much higher risk. The person taking the medication, doctors usually will say, there are some side effects to the medication I'm prescribing, and we should really sort of watch out for it. You may feel some muscle tension, you may feel some muscle tremors, you might experience some muscle twitches. If any of that happens, let me know. Something like that. So the patient should be educated by the doctor and should watch out. So while I say that the patient would be the best person to become aware of it first, there is some phenomena for which we don't have a very good reason that, in fact, the index patient may not be the best judge because they often are unaware, even when their lips are moving, their tongue is moving back and forth, their fingers are twitching. They simply are not aware of it.
My TD condition started after being on an antipsychotic for 4.5 years. It was a side effect that I never thought was even possible, so I wasn't looking out for it. It ended up happening in the fall of 2014. I started having really weird symptoms. I didn't tell a doctor because back then a lot of the doctors I had just kind of said, well, talk to a therapist, maybe you need to work through these other symptoms, and often wrote off my physical problems.
TD is not painful. It's painless. And so someone may have it and may not know it. In that case, an observer, a family member, parent, brother, sister, spouse, a friend, they would notice it and they would say, well, why are you blinking your eyelids so often? Why are you moving your mouth or your tongue so often? I see that you do it a lot. And the patient may respond by saying, no, I don't. Or I don't know what you're talking about. Oh, that's nothing. But it could very well be TD. It often is TD. And that has to be brought to the attention of the doctor or the nurse so that they can examine it more.
I didn't really know. And the way that I found out was I ended up driving down to see my mother, and my mother's a doctor. And it had been a stressful car ride, and my the facial movements were just going nuts. And when I got out of my car and I went and talked to her, like 5-minute conversation, she's like, have you told your doctor about your issues with your mouth? So for the rest of the day, essentially, she had me doing a bunch of tests. She had me walk across the room and look at my gait. She had me stick my tongue out, try to roll it, put my hands out straight, move my hands to the side, sit with them just on my lap. And then as soon as I was done, she called my psychiatrist and she was like, I think Daria has TD, and it happened to be that the very next day I had my appointment. So when you're in that maintenance mode where you're stable, there are other things you need to look for, right? You're the person who has to be proactive, and you have to know when to call the doctor.
And if the person has mild movements in at least 2 parts of the body, or moderate movements even in 1 part of the body, then they have TD. And then they should be monitored during every visit to see if it is staying stable, steady, or is it getting worse? And sometimes it goes away. Or is it going away? So that's what the monitoring and testing is all about. The doctor, in consultation with the patient or a family member, has to decide, are they going to do anything about it? Because if it is very mild, then because there are not very many good treatments for this, whether we should unnecessarily expose the person to yet a new drug, maybe not well established, and then that drug may have its own side effects. So if it is very mild, an occasional movement, which I have assessed as TD, I may not do anything about it, except I want to make sure that I have the lowest dose of the antipsychotic medication. Interestingly, if I lower the dose, there is a paradoxical phenomenon. TD for a short while gets worse. And when the dose of the agent that is causing TD, the culprit agent, is reduced for a short while of 2 to 4 weeks, the TD gets worse. And one need not worry about it, that's expected, then it will settle down. So if it is mild, if it is moderate severity, that is quite visible, it is frequent, and it is bothersome, then one may want to treat it separately with another medication, in addition to making sure that the antipsychotic medication dose is the lowest. Now, if we can afford it and take the person off the medication, that is also advised, but more often than not in our field, that is not possible. It's not possible to take somebody off an antipsychotic completely, because then they might relapse in their primary illness, and that is much more difficult and much more disruptive to one's life. So if we judge as moderate, then it should be treated. And if it is judged as severe, then it should definitely be treated.
When I went in and that doctor first diagnosed me, she said, we're going to go ahead and we got to get you off this med. But of course, no psych med do you drop, especially an antipsychotic. So she had to wean me down, but she informed me, for some people, this is irreversible. And I just wanted to cry. I couldn't imagine this continuing. I was really worried about it. I was extremely lucky because as we started weaning down, the symptoms went away. Now, if I was excessively stressed, it would be very obvious.
Although TD, Tardive Dyskinesia, is a serious side effect, and many times by itself is irreversible unless we treat it with these modern drugs, one should not hesitate to take the treatment with antipsychotic drugs if an appropriate medical diagnosis requires that one take those medications. So just reading the book and saying, gee, I could have TD, therefore I'm not going to take the medication, is not such a wise decision, and I don't recommend that, because the disruption, the suffering, the distress from the primary psychotic illness will be much, much more severe than anything with TD. The second message is one should be watchful for side effects, including TD type of side effects. And the way to watch for that is to know what the side effects are, what they look like. Third message is, although for many years there were no treatments, now we do have treatments, and therefore one should feel more hopeful that these things can be treated more effectively now in the last 5 years than they were ever before. And the last message is that these are not curative. They will treat it temporarily, so continue taking the medication. The side effects are minimal.
I just think, the earlier you catch it, the better. Work very closely with your doctor. Like I said, once my doctor discovered it, she wanted to get me off the meds as fast as possible, but it was extremely important to make sure that I weaned down. I talked with her about making sure I had another med in place that would help me stay stable. I also worked very closely with my circle of care to say, hey guys, I'm switching out these meds. I need another set of eyes. I need you to watch me closer, because it's not just, trying to get better, but it's making sure that when you're trying to help the TD, you don't lose your stability. So I do believe that it was causing additional mental health problems to have the movement disorder. But, it's so much better now. It doesn't mean like it's going to be like this forever. Sometimes when you get off your meds, it improves incredibly. And I've been blessed like that.